From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Strengthen Our Culture and Capabilities. Bon Secours Strategic Quality Plan has 4 goals, and one of those goals is aimed directly at our most valuable asset, you, the Bon Secours employee. We've all heard before that a company is only as strong as its workforce, and as a leader in healthcare today, Bon Secours knows that to be a reality. So one of our Strategic Quality Plan goals is to strengthen our culture and capability. And here's how we describe that. We recognize that the healthcare delivery system is undergoing rapid change with increasing complexity. Thus, we commit to liberate the potential of our people by strengthening individual and collective capabilities with respect to ministry leadership, knowledge, analytics, innovation, and finances. So we sat down with some of our leaders to talk a little bit about strengthening our culture and capabilities for some insight into what that means. Here's what they had to say.
I think when we talk about strengthening our culture and capabilities, we are creating a culture that is other-oriented. And that, again, it is the continuing that call and focus to understanding the diversity that makes up myself, my community, my work environment, the global work that we do. It is recognizing and celebrating the diversity and then working toward bringing all of that to wholeness.
Well, I think one of the things that comes to my mind right now is the the work that we're doing on One Bon Secours. I think that, to me, is going to be, a really good way to strengthen the culture of Bon Secours.
To be able to move forward together, there are 2 important aspects of that. One is we can only go forward together as a people. And so the importance of investing and sustaining our culture as one Bon Secours creates something new. The other is that we have to recognize on the horizon what are those gifts, talents, capabilities, competencies that will be needed to meet the challenges of tomorrow while sustaining the demands of today.
How do we equip our employees with the skill sets that will still be meaningful and important 10 or 15 years from now?
I think one of the biggest ways we're strengthening it is by ministry formation and leadership formation. And in some places you wouldn't find people as generous as you find in Bon Secours in bringing people to these programs and giving them time off from duty to go to the programs and helping them be ministers, to be able to live out their ministry. So the culture is very important. It's the way we do things around here, and Bon Secours knows how they want things done.
Bon Secours' Strategic Quality Plan is reimagined every 3 years. And we're about halfway through the first year of this new plan. So many of us are paying attention to this new plan and discovering how we can contribute to its success. Mainly because success of the plan translates to success for Bon Secours, and everyone wants to be associated with a successful organization. And to help everyone better understand and digest this important document, Bon Secours has developed a new interactive Strategic Quality Plan website to help provide additional insight about the plan, our strategic goals, and our desired future. This interactive learning tool provides a rich background of data for each aspect of the plan and details steps the system is taking to reach success. The website is available to everyone at www.bonsecoursqp.com. When you get there, simply enter the password Good Help and you're in. It's available from work or home on your computer, tablet, or smartphone. Check it out today. The Bon Secours 2016 to 2018 Strategic Quality Plan. Our roadmap to the future. In other news, Good Help ACO. You're familiar with Good Help ACO, right? That's Bon Secours' wholly owned entity that is charged with managing Bon Secours' patients across all segments of the continuum of care and stems directly from the Accountable Care Act. Well, the good news is that Good Help ACO was selected as one of a handful of renewing Medicare Shared Savings Program accountable care organizations. So a little background on those who are not familiar with accountable care organizations. Doctors, hospitals, and healthcare providers establish ACOs in order to work together to provide higher quality coordinated care to our patients while simultaneously helping to slow health care cost growth. Why? Well, for several reasons. First, the obvious, as we mentioned, to provide higher quality care while slowing cost growth. But ACOs also receive a portion of the Medicare savings generated from the slowing growth costs, provided, and this is important here, provided they also meet standards for high quality care. So essentially, as a provider, Good Help ACO is paid based on the quality of care and not necessarily the quantity of care. According to Health and Human Services Secretary Sylvia Matthews-Burrell, Medicare and the healthcare system as a whole is moving toward paying providers based on the quality rather than just the quantity of care they give patients. People across America are going to be better cared for when they go to their healthcare providers because these hospitals and providers have made a commitment to change how they do business and care for patients. And now Good Help ACO has been renewed as a Medicare Shared Savings Program accountable care organization. But if you take anything away from this story today, it should be that at the end of the day, ACOs are all about delivering better care, spending dollars more wisely, and having healthier people and communities. And when you go to www.bonsecoursSQP.com to look at our new interactive SQP website, look for where this falls into our long-term goals. Strengthen our culture and capabilities? For sure. Co-create healthy communities? Definitely. Be person-centric? Probably. Serve those who are vulnerable? You tell me. Finally, Our Lady of Bellefonte Hospital in Ashland, Kentucky has been named as one of the best places to work in Kentucky. This is great news for Bon Secours as the Kentucky Chamber of Commerce and the Kentucky Society for Human Resources Management made the announcement on January 25, 2016. Significant in this announcement is that Our Lady of Bellefonte Hospital is the only healthcare organization in the Ashland area to make the annual list. OLBH was named one of the 2016 Best Places to Work in Kentucky in the large-sized employer category. The selection process, managed by Best Companies Group, is based on an assessment of the company's employee policies and procedures and the results of an internal employee survey. So this is largely based on what Our Lady of Bellefonte Hospital employees think. OLBH CEO Kevin Halter was quick to point out that this honor is possible because of the hard work of our more than 1,000 employees who make Our Lady of Bellefonte Hospital what it is for both our patients and, as evidenced by this award, for our fellow co-workers. Please join us in congratulating Our Lady of Bellefonte Hospital for being named as one of the best places to work in Kentucky. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Bon Secours Productions and is solely responsible for its content.